Thank you for joining the Society of Thoracic Surgeons webinar. This briefing will provide background information to prepare you to engage members of Congress and their staff members during the upcoming legislative fly-in. My name is Nick Beek. I am the PAC and Advocacy Manager here at STS. I'd like to introduce my colleagues, Courtney, our Director of Government Relations, Amanda Wiegraf, our Assistant Director of Government Relations, and Madeleine Stirling, our Government Relations Coordinator. I want to thank you for signing up to participate in the upcoming STS legislative fly-in. I hope you will find this a rewarding and educational experience and that you will gain tools today that will help you to develop relationships with your congressional representatives that will serve you and STS for many years to come. Before we get started with the advocacy briefing, let's take a quick look at the schedule for the fly-in. Wednesday night, we will all get together for dinner. We'll have time to address any questions you may have. The next day, you'll come back to 20 F Street for a light breakfast at 8 a.m. before spending the day on Capitol Hill. We will provide you with a personal schedule with all of your Hill meetings when you arrive. Over the course of these webinars, you will hear from several STS members along with staff. Together, we will walk you through the following topics: the current climate on Capitol Hill, the STS Political Action Committee and advocacy resources, including how they impact policymaking on the federal level, and our legislative ask for your meetings on Capitol Hill. Given how volatile our political environment can be these days, I'm sure many of you are interested in what you'll be facing when you arrive. The House passed a bill that would repeal and replace the Affordable Care Act, or Obamacare, on May 4, 2017. The Senate then tried and failed several times to pass their own version of repeal and replace over the course of the intervening months. The deadline to pass such a bill with just 50 votes using the reconciliation process was September 30th. Republicans will now need to win over 8 Democrats and every member of their own party to pass legislation or get rid of the filibuster. STS drew up health reform priorities back when the House first started drafting legislation and used these priorities to evaluate each health reform bill. You will have a copy of these priorities in your briefing materials and the packet you bring with you to Capitol Hill. Of course, you're welcome to bring your own perspective on the health reform process. Ultimately, like many other medical specialty societies, STS released statements opposing the Senate's multiple bills. This opposition was due to the removal of protections for essential health benefits, one of which is lung cancer screenings, and the projections that millions of Americans will lose access to health care. Throughout the process, STS has maintained a strong willingness to work with both Democrats and Republicans to improve the nation's fraught healthcare system in a bipartisan and open manner. STS is confident that with a concerted effort, major improvements can be made to the healthcare system. This slide provides an overview of some advocacy successes STS has helped achieve in the past few years. STS has had big wins on TAVR, getting lung cancer screenings covered by both private insurance and Medicare, the SGR repeal, and the preservation of both global surgical payments and crucial research funding that many STS members rely on. Many of you attending the fly-in pounded the pavement in D.C. to discuss these issues with your representatives. These efforts can be long-term and require constant diligence. There aren't always flashy pieces of legislation to celebrate. Sometimes victory means CMS leaves something out of a final rule, but I think everyone would agree that the results are worth the work.
How else can STS influence these important policy decisions? The composition of Congress matters when it comes to drafting effective public policy. It's important to ensure that the physician community at large, and cardiothoracic surgeons specifically, are both represented in and heard by Congress. STS PAC works towards that end. As the political arm of the Society of Thoracic Surgeons, the PAC, or Political Action Committee, allows cardiothoracic surgeons to participate in politics and make STS's voice heard. The PAC helps elect physicians and other allies of our specialty to Congress. The PAC exclusively supports candidates for federal office and does not get involved in presidential or state elections. Contributing to the PAC is one way to be an advocate, as is attending a fly-in. Hosting a site visit is another great opportunity to forge a personal connection with your member of Congress. We arrange all the details, and you run the show, educating your representative with a hands-on and lasting experience that works with your schedule. Of course, please use the STS Advocacy website as a resource. You can sign up to be a key contact, stay abreast of developing policy issues, contribute to the PAC, contact your representatives and senators, and more. We're actually designing a new website right now that will hopefully be up and running very soon, so keep an eye out for that as well. Many of you attending the fly-in are key contacts. If you're not already an STS Key Contact, it's easy to sign up online. Key Contacts are cardiothoracic surgeons on the front lines of advocacy efforts throughout the year, committing to at least one advocacy activity per year, and are our go-to team of advocates for the specialty. Key Contacts are the face of STS relations with Congress. We also encourage you to follow advocacy developments through our various email newsletter publications like Advocacy Monthly. Each month we publish quotes, photos, and announcements from and by Key Contacts in the Advocacy Monthly section, Key Contact Connect. Keep an eye out for your name in the November issue. Check-up with Congress calls are another great way to easily stay involved and speak to members of Congress. If you have any questions regarding the upcoming fly-in or anything to do with politics and policy, please do not hesitate to contact the STS Washington office staff. We very much appreciate you taking the time to familiarize yourself with these issues. Now, let's move on to the legislative asks we're hoping you will take to your representatives on the Hill. Just like it sounds, the ask is the main thing you are requesting that your member of Congress do for you. It could be as simple as weighing in with another member of Congress or signing a letter. In most cases, your ask may be to co-sponsor a piece of legislation or bring it to the floor. As I mentioned, you'll be guided through these issues by a number of STS leaders, all of whom are members of the Workforce and Health Policy, Reform, and Advocacy. First, you'll hear from Dr. Ali Khan Naji about graduate medical education reform. Next, you'll hear from Dr. Geeta Modi about tobacco reform. Third, Dr. Todd Rosengart will discuss the importance of the Agency for Healthcare Research and Quality. Finally, Dr. Raymond Singer will talk about MACRA. Please click on the next webinar to get started.